In the Netherlands, we have quite some farms that are not only doing agricultural production, but also provide services to different kinds of client groups, like psychiatric patients, people with dementia, troubled youth. And actually, people with dementia in this case go to a farm and have there a meaningful day occupation. Most of these farms, what I said, next to their agricultural production, they also have health professionals who are working there, or the farmer's wife has been working in the regular healthcare services. And the reason that they have been developing is that we were actually looking in the Netherlands for how can you develop a more meaningful and different kind of approach to adult day services. And these green care farms, it was just a very nice combination of farmer's wife having a background in dementia care and the farmer having the space and the different kind of activities where people can contribute to. So this was a very nice combination why these farms have been developed. And we've done quite some research over the last years to understand what can be the value of these kinds of services for people with dementia. And we learned that when people go to a farm, they are quite active actually. So if you would compare people with dementia visiting a farm with people with dementia visiting a more regular kind of adult day service center, you see that people with dementia are more active, are more physically active, are involved in a large range of activities, are outdoors quite a lot. So that can be quite beneficial for them in terms of health and well-being. We also did some studies to understand is their dietary intake or the fluid intake better, and also there we see that people with dementia visiting a farm have higher food intakes. They are often involved in meal preparation and they contribute to harvesting the crops and to preparing the meals. The meal is provided in a home-like small-scale environment. And these are all factors that can contribute to higher food intakes than in a regular day service center. And we have also looked into participation. So do they get social interactions and are they involved in different kinds of activities? And also there we see that both regular day services centers and farms can contribute to social interactions and recreational activities. But the added value of farms is that they can also give people with dementia the feeling that they can contribute to something meaningful. So sometimes they even feel that they are doing paid work on the farm or that they are doing volunteer work. So the perception of the activities is a bit different than the perception of people with dementia visiting a regular day services center. Currently we see quite a big difference actually between the visitors of a farm and the visitors of a regular day services center. At the farms it's mostly men, and if we're looking at the studies we have done over the last few years, we see that their average age is 73, most of them are still married, so they still live at home with a partner, whereas in the regular day services centers it's mostly females, and they are older, their average age is 85, they are very often widowed and live alone, and so the profile of the visitors is different. Which doesn't necessarily mean that older women are not suitable to go to a farm, but it's just how it is at the moment. But in general, I think people who can still be quite active and like to go outdoors or have in the past worked at a farm or had a garden themselves, that for them it can be a very good solution, I think, as compared to a regular day services center. Because in the Netherlands, very often in these kind of services, people are more indoors, the activities are more related to social interactions, recreational activities. And if you like that, that's fine, of course. So it's not that the green care farm is the best solution for everyone, but I think the main message is that we need some diversity, because people with dementia have different preferences, different capacities, and the alignment between the services provided and what you like as a person is very important, I think. The green care farms are now further professionalizing. Currently we have about 1,000 farms in the Netherlands providing these kinds of services, and I think about 20% of them is providing services to people with dementia. Currently it's mostly adult day services centers, so a first development is to move to 24-hour nursing care, and I think there are about just a small number of farms already providing 24-hour nursing care. So that is one development. And the other development is also to see what can regular day services centres or regular institutions learn from the farms. There are quite some elements that are, or facilities and activities that are provided at farms that could also be provided at regular healthcare institutions, like taking care of animals, or like involvement in meal preparation, or contributing to domestic activities, things like that. We have just started a new study with funding of the Alzheimer Society in the Netherlands, and there we want to know, okay, what kind of services and activities can actually be transferred to the regular healthcare institutions, and what kind of facilitators and barriers can be expected where you want to transfer these kind of elements. So we also want to investigate what can other institutions learn from green care farms, and at the same time also the green care farms need to professionalize more. So there are different kind of developments taking place, and as it's a quite new intervention or quite new kind of services, a lot of research is always necessary to better understand its value.